All right, Casey. So let me just make sure I'm recording. Yes, we are. Okay. So 5, 4, 3, 2, and 1. All right, folks, welcome back to the Trauma Therapist Podcast. I am very excited to have as my guest today, Casey Stevens. Casey, welcome.
Thank you. So happy to be here.
All right. So Casey is a licensed psychotherapist, consciousness coach, and a healer with 10 years of experience who utilizes a multidisciplinary approach to cultivate a deep connection with their clients' sacred inner wisdom so they too can live their most meaningful life. Her process includes offering presence, attunement, release, restructuring, activation, and fortification. She says what she likes to do is kind of like tuning a fine piano. She listens in order to feel the sound waves, energy, and patterns and structure in a person with her hypersensory awareness and the ability to know which keys are out of tune and therefore needing to be restored and rebalanced. Well, it sounds something that's very necessary for a lot of us during this crazy time. But anyway, just a little bit about you, Casey. Share with the listeners before we get going here where you're from originally and where you're currently calling from, and then we'll dive in.
Yeah, well, that'll be easy. Born and raised in Seattle, and I'm currently in Seattle. So
All right, all right, very very simple there.
very
Well,
yeah.
let's dive in here. So, how did this path start for you? How the heck did you get into this field and specialization?
Yeah. Well, it's a big question probably for lots of people, but it's been an interesting kind of circuitous path for me of I kind of almost think of it as this former life that I had um, that I was married. I worked in interior design and kind of in that design field, and through lots of, frankly, personal pain and loss and dissolving of some of those structures that were set in place for me, that were a huge part of my identity and my life for 12 years. I mean, the beginning of my adulthood, um, really kind of started to unravel, and I got then the opportunity to choose what to do at that time. And I really leaned into wanting to be more conscious and wanting to be more aware about what was happening, and working towards healing that. And so entering into different forms of therapy and healing at that time, which, involved couples therapy, involved individual therapy, and getting to learn more just about myself and like, why the heck was this happening to me? Right. So, so that really is the beginning. And it unfolded in a really, I would say, organic, beautiful way for me. That as I explored, I became more curious about doing this work myself. And it was probably a year or two of my own kind of being immersed in a therapeutic scene, and many, again, like unraveling, dissolving of just structures and systems and relationships that were quite devastating, traumatic, right? They were
Mm.
traumatic for me, that I finally walked into my therapist's office one day as I was like really having to rebuild my identity, and said, I think I want to do what you do. And she told me, I've just been waiting for you to say that. So then it became a very deliberate, intentional uh, process, really, where I went into grad school right away and started to learn even more, continued with my own healing. Um, and I also have to really credit her because she allowed me to tap into and access a kind of healing that was particularly appealing to me, which is, I just kind of think of it as multidimensional, right? So she wasn't just doing cognitive work with me. She was I think attuning to my spirit, to my soul, to my heart in deeper ways that I knew was always a part of me, but I guess that had been a part that I had disowned in some way, or not been so connected to
Let
during
me
that time.
let me,
Oh,
if I may, let me pause you right there for a second because I want to get into that. But I want to go
yeah.
back to something you said earlier, which was there were pieces of your identity that were really impacted. Can you share a little bit more specifically about what one or some of those were?
Sure. Well, like we just think of the primary that we come to as unconsciously, right? These are patterns that we learn, then we, they build and grow. And so for me, I mean, a lot of that was being a wife, having, an established just presence and home and community and family that was extended beyond my own family, who is wonderful and loving. But to me, that was really exciting. And interesting because my husband came from a different culture than I did. So to me, there was always something really kind of mysterious and alluring about that, right? Very interesting and romantic even, right? To merge with that. So I kind of integrated a lot of those parts, so I mean, simple identity pieces, right? That we can all break down and acknowledge, right? So just whatever the aspects of those pieces that are showing up, right? Again, for me, a massive part of it was not only being a wife, but like being partnered to my husband.
Mm-hmm.
That probably I over identified with, honestly. And so when those parts start to dissolve or break, right, it feels like, oh my gosh, who am I? And have I been doing things that are more aligned with him and his life than my own life, right? And who am I in this? And certainly not all of those parts were lost, but some of them that I had to um, just I had to reconcile, I had to reintegrate, I had to heal, I had to rediscover. And so many of those pieces, which are, complex and also simple, right?
Yeah, I mean, I really appreciate you sharing that, because I think, that's kind of a piece that a lot of us don't really think about, how when we lose those kind of identity pieces, how traumatic that can be. Because oftentimes people think of trauma, as these like crazy events, right? And even though, you know, losing some of those identity pieces can be crazy and traumatic, we don't normally associate those with, I think, uh, events that could be traumatic. And I really appreciate you saying that. The other thing you talked about was, you know, the profound impact that sounded like this therapist had on you, and specifically in terms of like bringing out or contacting or tapping into the spiritual side of you. Talk more about that.
Yeah, sure. I mean, I think, to be honest, that was always kind of this woven part of me that I think I just came from ancestrally. Like I have a lot of strong women in my family, women who happen to kind of embrace the mystical. It can be different religions, right? Like I grew up, my mother's mother, and it goes back much further than that, but she had statues of Buddha and Native American drums. I mean, she just kind of collected all of that. And I don't think I had really fully tapped into, um, I think the ancient wisdom, the multicultural aspect. I hadn't just fully embraced that or tuned into that to the degree that it is available. And so something intuitively in me drew me to my therapist, and I probably didn't even consciously know what it was. And then as our connection unfolded, she would just tap into these different realms or these different parts, which felt so nourishing and satisfying and expansive and just healing to me because she utilized them in her practice, even though she was.
Like what? Get more specific, because I want to
Oh, I mean,
put a name to
I
these
would
things.
say even, yeah, her intuition, and just like little different healing modalities. Like she was certified as a clinical hypnotherapist, so she was using a lot of like unconscious work, holding space for that, though not in a directive way, but just
Mhm.
as like really allowing me to explore the expansiveness of my own unconsciousness. So many, it's like her presence, right? Things that she would talk about as she would tune in, that were frankly intuitive, just kind of like downloads, right? um, and but they felt true to me, and they felt wise to me, and they helped me also. I mean, she was really just reflecting back to me what was inside of myself. And so, I mean, so many more things, right? Little special moments or whatever. And it's really kind of like the accumulation of all of those things that I think we
Hmm.
begin to reintegrate those parts of ourselves in a sweet way.
Yeah, yeah, awesome. Yeah, I think it's just important to, sometimes to name those things for
Sure.
the listeners out there. And also, I think it's really important to honor that. I mean, it sounds like you were lucky to have found this therapist, because a lot of times we go to a therapist and it just doesn't work out, and that's it. All therapists suck, whatever. But to find someone like this, it
Well,
sounds.
yeah, and I think, I mean, I really do credit, like there was some wise part of me, this intuitive part that I felt into that. And it ended up being a sweeter place than I knew, because that aspect, again, I mean, we're just reintegrating parts, we're just mirrors for each other. So the more unconscious we are, I mean, that had been unfolding for me for a
Hmm.
while. And then I got to do it in this really like awake way, right? Where I was more
Hmm.
aware of what that was. And I got to dive in and kind of explore those parts of myself, right? Frankly, that again, like I pull from my own ancestry, and the women in my life who connect to that kind of mysticism, that spiritual quality, and that like connection to a higher power and presence. And not that I didn't have that, but it was like, wow, I really connected with it, right? And that just continued, and frankly, like my passion for that and my interest in that just grew and deepened
Hmm.
and evolved, and has done so over the last, more than a decade, right? Since I started all that process. So,
So you realize that you want to pursue this. You go to graduate school. How do
yep.
things unfold? Take us there.
Well, so many things unfold. There's probably more than we have time to get into, but yeah, it unfolded, me, I think, just continuing to reclaim those parts of myself, understanding more like, this behavioral science and the systems, and not just from experiencing it, right, one on one with a therapist, which is, there's so much beauty in that parallel process, right? But then starting, because I do have this very kind of analytical, critical mind that wants to like understand how things work and have the bigger picture and all of that. So, I mean, it was a sacred place for me to explore that and take in that kind of material knowledge, that like science of just human behavior and
Hmm.
relationships and systems and all of that. And so, and that evolved. And I honestly, I had more, I would say, traumas and losses during that time too. And it just helped me to kind of absorb and integrate and transmute those, because of the work I continue to do on myself, and also the work that I was just learning about.
Right.
And I just got this like also very clear just gnosis, right? That I wanted to move from, okay, there's this traditional understanding of psychology and human behavior, but I want to keep absorbing that, right? I want to dive into maybe some of these alternative ways of healing that are also very interesting and I've personally found useful. So, I sought those out as I would say it was probably after I left
Hmm.
grad school and all of that, and integrated that. And then there was a time that I still kind of was unsure, right? Because as I went straight into private practice, and I was kind of unsure. It's like, okay, well, how much of that side of myself can I share with people? Because what will be accepted? And so, again, some of my own fears around being seen, being accepted for maybe this, a little bit out there way of practicing and incorporating the wisdom that I held, the gifts that I held, but also things that I was learning, and just like how will that work, right? If I'm opening a practice, I don't want the people to like scurry away and not be able to help them, because this is what I want to do, and this is what I'm supposed to do. So I kind of struggled with that for a few years too, of
Hmm.
just maybe over identifying with the very traditional parts of myself and my learning and my studies. And then eventually kind of being able to break out of that and knowing, you know what? I am holding on to something, this treasure, this part of myself that I'm doing my clients a disservice by not fully embodying that and expressing that and giving them access to it. But I'm doing myself a disservice too, because I'm not fully showing up in the truth
Mm-hmm.
of who I am.
It's kind of reminding me of that your original
Yes.
identity loss in a sense,
Yeah. Well, and it was just layers, right, of peeling that back.
right.
So which was a process. And to me, I mean, it was so big and had felt really like a trauma in many ways. And of course, I'm leaving out many pieces of all of that, for time's sake, because we could be here for days, but of just like how deeply woven that was into my system that needed to be peeled back. And that just took time and space and patience and
Mm-hmm.
persistence and all of those things with my own healing, and frankly healing through the reflection that my clients sent back to me. So
That's a really interesting piece that, what you're talking about here is struggling in a sense with how much do I share of who I am and what did that look like in practice? How did you work through that? And at what point did you say, all right, something needs to shift. I need to just like open the gates more.
yeah, I think my soul wouldn't let the gates stay closed anymore. So it was just like a, divine kind of evolution. But what that looked like, to backtrack, is what I had to look at and continue to grow through were a lot of my own like rescuer, caretaker um, patterns that had frankly shown up in my relationship with my husband. He struggled uh, with some deep depression, and what I had done during that time was to go into a lot of over functioning, caretaking, rescuing. I didn't even know those were parts of me, but of course, those go back even longer than that. So when these difficult moments showed up, I leaned into that. And of course, coming from the best place of like deeply loving him, being devoted to our marriage, wanting to make things better, but I was doing it in a dysregulated way, right? I was doing too much. I wasn't allowing him to have his own process. So again, like the way that was and then frankly failing at that, right? Like I never, like this caretaker in me that wanted things to be so a certain way, it didn't work,
Mm.
right? And that was because I was doing something for him that he couldn't do, so, or wouldn't do, or didn't wasn't available to do. So um, I think the healing of that inside myself continued to express itself for a while in different, smaller ways, of course, right? But when I would have a client who maybe was suicidal, um, or extremely depressed, not in their own power, um, not in their own dominion, not choosing healing, but choosing suffering, right? And victimhood. Um, I noticed in small ways, again, this is early on in my career. I think I'm pretty good at detecting that now and not over functioning, because really we're not helping anybody, right? When we do that, or we're doing it for our own, reasons. So the way that I even over identified with that and hadn't even pulled out all of the ways that was still expressing itself in me, it took years to
Mm-hmm.
unwind. And so moving then from being a helper, right, or a caretaker or a rescuer in some instances, or instances that I over identified with personally, probably, and not that I did anything too extreme, but just like, am I putting more investment or more energy into this than they are, right? So
Right.
it's measuring that energy exchange at all moments. And um I learned that what was most effective was to hold that container for people and give them the choice and the dominion and show them the truth of their power, reflect that back to them, but allow them to really choose healing from a place that they owned completely. And I just got to witness and participate in, but it belonged to them, right? It was them
Mm-hmm.
becoming more of themselves rather than me needing to do that from any unconscious wounded place that I had carried, frankly, just in my energy field, right?
Yeah. I appreciate you sharing that. And obviously what you're talking about, one component of it is the necessity of doing one's own inner work and
Yeah,
exploration of traumas and so forth, and
totally.
how integral that is to being a therapist, right?
Yes.
For me, when I was seeing clients when I was in graduate school, so much of it was about just shoving as much information as I could into my head. And even though I had, had experience with therapists and been in therapy, I didn't realize how integral that was to doing the work in a sense.
Yeah.
Um, you've shared a little bit about kind of early clinical errors, but can we put a frame around one that you'd like to share in what you learned from that?
Like a specific incidents or just like a,
Yeah, specific incidents.
interesting. Um, well, I kind of, again, I kind of think about that. Uh, I mean, I can think of more than one. I can think of a handful, honestly, where I had people who, frankly, might have struggled with deep depression, clinical depression, suicide ideation and intent. And I, went up to that line. I mean, I would just like really didn't just go up to the line. I went over and would do this over functioning thing, rather than allowing them to have their process. And so, again, like a handful of where I'm trying to pull things out rather than just holding space, or
Mm-hmm.
I'm trying to instill or infuse something, that I think they might need, but I don't know what the wisdom of their soul really needs, right? Not allowing that to unfold. Um, so again, I can think of like in my early career, and not that there were any drastic errors made, right? But just me over functioning, me trying too hard, me trying to rescue them from a state of being that they were in, and all good intentions.
Mm-hmm.
Um, but they, again, didn't have the space or the dignity of their own process to fully just sit in that and not have whatever feeling about it, because there was some way, and it might have been subtle, but that I was reaching, or I was desperate, or I was uncomfortable, right? Which is a big one, with their despair or their degree of kind of destitution or pain or whatever that was, and frankly wanting to abandon themselves in that. So then what do I do? It's like, reel in. And so again, I can think of a handful of incidences where people were really struggling, and I'm sure obviously what I provided was useful, and probably a little too useful, and not completely holding the space for them to
Mm-hmm.
just express that and move through it in a way that they were still okay, but that they had more ownership of, I would say. I hope that is answers your question.
Yeah, I appreciate that.
Mhm,
I think a lot of people out there listening
mhm.
need to hear that, people who have experience have made quote unquote mistakes or errors, or there
Yeah,
have been blips in awareness or consciousness. One
totally.
of the things you talked about, Casey, that I want to bring up is you talked about early on kind of owning maybe a more traditional
Mhm,
identity of therapy, and you contrasted that with maybe what you're doing now. Talk more about that, because
mhm.
that dichotomy is very interesting to me. um, Talk more about that in a sense.
Yeah. So I would say that framework, that whole system that is, grounded and scientific, is very foundational for me. And again, who I am, and we all bring that. I think as therapists, we all bring like ourselves to a degree, like blending that. And for me, I just knew I needed to do that more. So it can look like for me, an example is um, I'm my intuitive gifts have completely expanded and gone to a different level as I work with people, as I've gone through my own trauma and my own healing and my own awareness of self and where I source that information from. And one of the key places is I feel like I connect with somebody, and if there's again this contract and this consent to work together and to open yourself up in this way, I can oftentimes feel people, and I don't just mean in an empathetic way, but like I feel where their trauma is stored in their body, and that happens in the space of a session. And then that session's closed out and the energy's disconnected and they go back. But one of the ways behind some of the ancient kind of trainings and healing modalities that I've learned is just frankly my own gifts, my own ability, and the way that I feel that it's just something that happens. So much of it can be, I mean, it can examples of that, because I'm sure you'll probably ask, right, are somebody showing up for a session and then all of a sudden I start feeling like a tremendous amount of anxiety or a ball in my stomach or something. And at first I didn't quite know, like, gosh, what's going on? I'm feeling, and then realizing over the course of my career and the deeper work that I go into people, like, oh, that was me feeling them. They were showing up and they were nervous before they got here. They have this, struggle that's going on, that's whatever in their life right now. And I could start to feel it. So what I do in a lot of my sessions, which to me is very somatic, right? It's a way that I can, not do hands-on healing with people, but help them move that energy, is reflecting it back to them, holding space, holding a container, so that
Mm-hmm.
trauma that we all know is stored in the body or the different layers of our being. I feel what they're feeling in this really kind of intuitive, like clairsentient, claircognizant way. And then I hold that space without doing what I used to do, which is kind of jump ahead and tell them what I'm feeling, and what's in them. But if they need a guide or a container to hold that, so that then I can help them move that energy, whether it's a trauma, it's a stuck memory field, it's a, whatever. I mean, all of the things that can be expressed in so many ways, like inner child stuff, whatever. It's like I can be guided to the kind of wisdom around that. And I feel it. And so I can help them move through that, and heal that fragment, that part, the trauma that's stuck in that piece of them, so they can, get closer to wholeness, right?
Mm-hmm. Mm-hmm.
Not
Yeah.
having that. Yeah,
Right. Right. Yeah. I really appreciate that. I mean, it brings up for me a self-trust and honoring,
totally.
who we are and whatever abilities we have.
Yeah.
Um, and your journey sounds a lot like, you know, you had to get to that point where you really trusted who you were and the gifts and abilities, using your words, that you had. And
Mhm.
I'm again putting myself in the seat of the listener who's
Yep.
listening to this and thinking, that makes a lot of sense to me. How do I mean, aside or in addition from doing my own therapy, how do I find that or get into that, or what do I need to do to tap into that more?
Yeah. I think of it as consciousness. So you're all tapping into it, but a lot of those systems that are running are unconscious. So we don't know where we're sourcing things from. And you're exactly right, because when we lose our identity, or parts of our identity, or that has to be re-established, what's also lost primarily is trust, in who we are and what we knew, and how we experience things. And so building that up to a place where we can now trust, not externally what those things that we think we identify with are, but internally, like where that is sourced from, what we feel, what we know, what expands us, what contracts us. It's really kind of tapping into that on a deeper level, right? I think there are different layers of healing, right? So or experiencing life, where things happen to us, then they happen for us, and then they eventually happen through us when we evolve
Mhm.
to that place of knowing we are the agents, but we can handle anything, and we know how to handle it and what that feels like to move, which isn't, again, bypassing anything, but it's like being able, knowing that we can be with really hard things, trauma, whatever, we can be with it, and then that can move through us because there's a larger, bigger part of us that chooses that, and is completely capable of it, right? So, um, I mean, I help healers do this, and I say healers because I mean, therapists or people in healing fields, right? tap in and know like, okay, well, what am I feeling? Where am I feeling that? What does it mean? What's it connected to? And almost like breaking down, like we go so deeply into the minutia of something, to then bring it back out and expand that into the expression of ourself, to the interconnectedness that we have with other human beings. And just like the reason we're here, I think, on the planet, is that interdependence of relationship, our connection to, again, whatever our higher power is, and how all of that works inside systems and programs and structures that are around us. And how do we make the best of that? How do we tune into that? So I hope that
Mhm.
answers your question.
Yeah, I think so. Let me just remind everyone that I'm speaking with Casey Stevens. And your website is shrinkbigger.com, correct?
It is,
Okay.
yes.
So you said you help people do this. Are you offering courses, coaching, what? And for whom?
Yeah, I do have a coaching program that I kind of, again, will work with healers wanting to sort of embody this more mystical. And when I say mystical, I mean kind of like the unseen, right? So these parts of us that we might not be consciously aware of, but how do we become conscious of that? So I do that in groups and in courses. I work one-on-one with just clients, right? Clients who are curious about these aspects. They don't need to know a lot about it, but they want to learn. So
Mhm.
that could be anyone on the spectrum, right? Of any, frankly, kind of dysfunction or disturbance or dysregulation in their system, right? And helping them kind of tune in to the place so they can move from, this thing happened to me, or for me to really experiencing that through quality, right, of dominion. So of course I work one-on-one with people. I love doing that work. It's just like very close to my heart. And yeah, so those are some of the ways that I do all of that.
Okay, awesome. All right. So as we kind of wrap up here, how about a go-to book recommendation, whether it's therapy
Mm,
related or not, or trauma related or not? What would you
yeah,
like to share?
sure. Good question. So many books, so many beautiful things. One book that comes to mind, I read it years ago and it sticks with me really, is actually not you know, a book about therapy at all, but just about the human experience and relationships and love and devotion. And there's an author and writer named Calvin Trillin, and he wrote a book about his wife, and maybe you've read it. Really like a beautiful tribute to her life and her life after she passed. And so that just kind of like touches my heart in a sweet way. The reverence that he shows, also like the challenge, right? The imperfection of the human quality, but also how that evolves and how we can still hold people and relationships beyond all time and space. So I love that one. It's called About Alice, if I didn't say that,
Okay.
by Calvin Trillin. And um, then I would say like therapeutically, which might also be kind of a little out there, but I love Joe Dispenza's work. If you know who Dr. Joe Dispenza is. And so one of my favorite books of his is Becoming Supernatural. Um, the book is about the how we work with the quantum field and the science, frankly, of our human bodies and our body mind, and how if we're experiencing something in our body mind, we can be more powerful than that by um, you know, pushing through it and doing certain, meditations and just accessing that all of that agency and power is in us to then access the quantum field. And we're
Mhm.
always all accessing it, but by doing that in a intentional, mindful way so that we can then connect to the field. And again, this is all physics and science. And it's, he tracks and measures all of this stuff, which is just beautiful work, I think. But he really connects us being able to access the quantum field, the mystical experiences, and bring them back into our body in a very embodied way so that our body mind is wiser, it's stronger. And when I say the body mind, I mean our body has a mind, right? So the way that we hold whatever we hold there, right, can be traumas, can be imbalances, whatever, we can optimize that, right? We can maximize that in a beautiful way. So I'm not sure if other people have recommended his work, but if I just find it really valuable in the way that it balances science and mysticism. So, and our
Awesome.
ability to heal, right?
All right. So I'll have both of those listed up here at the show notes page at the traumatherapistpodcast.com. So Calvin Trillin's work and Joe Dispenza. Casey, thank you so much. I really felt that you shared from your heart.
Oh, good.
And I really appreciate that. And I hope that's what this podcast is about, because it's so not only informative and educational, but it's inspiring, and it's about that relationship and people connecting to each other. So I want to thank you so much.
Oh, I want to thank you so much. It's my privilege.
All right. We'll be in touch. Take care.
Okay, bye. Thank you so much.